Dr. Kenneth Hughes in Los Angeles, plastic surgeon, discussing with you a little bit about body lifts, okay? Body lift, as you may interpret, it means, obviously to lift something on the body. The question is, what are you lifting, okay? So most commonly it's referred to, or people refer to something called a lower body lift. Lower body lift encompasses a tummy tuck and then also a posterior lower body lift, otherwise known as a circumferential belt lipectomy. And circumferential belt lipectomy is actually most instructive and elucidating of the names, because it is what it says. It's around in the form of a belt, okay, all the way around the body, and you're basically removing something, okay? So you're removing loose skin and fat around the midsection of the body. So this is appropriate for people who've lost a lot of weight, sometimes in pregnancy, sometimes people have skin laxity issues for all kinds of reasons. So the question becomes, what is the best procedure for a certain individual? Now, a lot of patients will be a candidate for a tummy tuck, but not for a circumferential lower body lift, okay? Why is that? Because a lot of the patients who need the tummy tuck may be just post-pregnancy. They have some rectus diastasis or diastasis and abdominal wall laxity, as well as some skin and fat accumulation on the abdomen, but they may not have circumferential, in other words, extending to the back. So definitely there's a subpopulation of people out there who are candidates for the lower body lift. So many more people are candidates for tummy tuck, and much fewer are candidates for the lower body lift. So the lower body lift, like I said, once again, is kind of a combination of a tummy tuck, i.e. removal of skin and fat on your stomach or your front part of your body or your anterior portion, and then the posterior lower body lift, which is removal of the tissue, kind of like a tummy tuck for the back, okay? Now, the tummy tuck, like I said, can involve, some muscle laxity concerns, and so you need to address that with plicating the abdominal wall, kind of reducing the rectus diastasis and or the global laxity, or wherever the laxity is along the obliques. You can put sutures in to basically reduce those areas or strengthen those areas. Plicate, in other words, take tissue and kind of bring it together, kind of to overlap certain areas, okay, that are intrinsically weak. So lower body lift is basically those two things. So it's not a very complicated issue. The issue is, what does it address? And sometimes that's where people have questions. For instance, for the tummy tuck, I think it's pretty obvious that it addresses the tummy. It addresses if there's a bulge in the abdominal wall. You can address hernias as well. You can remove skin and fat that's hanging at the bottom. It also addresses skin and fat that may be at the top of the abdominal wall. So if there's a lot of loose skin and fat above the level of the umbilicus, you're going to need the full tummy tuck. And so you're also going to need somebody to dissect all the way up to the xiphoid and to the costal margins to recruit as much of the skin and fat envelope as you can to kind of release and pull down all of that tissue so that you get as flat a result as possible. So that's a technical aspect of this, but it's something to consider, because different people's anatomy will be more difficult to generate a certain result if the surgeon is not doing the dissection or the surgery in a certain way, okay? The other factor in a tummy tuck that's most commonly overlooked is how the flaps are trimmed and how the tissues are brought in from the waist. You can simply pull the flaps straight down, which is technically the easiest, but when you pull the flaps straight down, you're creating more boxy appearance, and that boxy appearance is not per se pleasing. It's making the individual more square. If you actually pull those flaps more towards the midline from that external portion from the sides, then you're actually contouring the waist, and the waist is looking smaller, and the waist to hip ratio is improved. So that's another important aspect of tummy tuck. Certainly everything else is important, like a low-lying scar that's symmetric, a natural-looking belly button. All of those things are important. But those are two of the things that make some of the tummy tucks look extremely different, okay? You can use adjuvant, additional liposuction to kind of improve tummy tuck results as well. You do have to be careful when you start invoking a lot of liposuction to correct certain things or to bring in the waist. You've got to consider the blood supply, especially if you're going to do a lot of liposuction on the lower back and the sides, okay? No one really extensively liposuctions the tummy tuck flap. Everyone knows that can cause tummy tuck, or that tummy tuck flap can necrose or it can die, okay? So everyone knows that's a potential complication. So not a lot of people will liposuction. If they do, they won't liposuction a lot. It will be given kind of, in names, for namesake only. Now, on the posterior, you got to realize that there's, there can also be a blood supply issue there. It's determined by the level of undermining on the posterior lower body lift. So for instance, what do I mean by undermining? I mean how much tissue are you dissecting above and below the incision so that you bring those two areas together to meet. So obviously the more tissue you recruit, the more potential skin you can get out, or skin and or fat. And so that is something to consider when you're trying to create the best contours. Now on the lower posterior body lift, what does it address? That's not as obvious as it is in the tummy tuck. In the lower posterior body lift, you're kind of addressing the sides, okay, the lower back. You're also pulling up on the buttock if it's executed appropriately, and you're also pulling up on the lateral thigh, okay? So a lot of people will have some lateral thigh fullness. It's not per se ideal, because the farther you are away from the point of concern, the less pull or the less improvement you're getting in that area, which only makes sense. It's the same concept as, doing a groin incision inner thigh lift and expecting somehow the area from midway down to the knee to be improved. It's not going to happen. So certain things on the lower posterior body lift will be more reproducible and will help more with certain issues. For instance, lower back laxity, buttock laxity, all of those things will be improved. Less or so will it improve the lateral thigh, although it can improve it significantly. And it's certainly not going to improve bra rolls, especially those that are higher up on the back. You may need a bra line back lift. So those are all things that you should consider before you consider, what procedure is appropriate. Tummy tuck, posterior lower body lift, bra line back lift. Yes, you can do liposuction, given that it's done in a technically well-conceived plan. And you can also obviously take some of that fat and then transfer into the buttock. It depends upon how you're doing these procedures. So for instance, a lot of people, they have volume loss and they're not going to have a round buttock after a lower posterior body lift. If anything, they're going to have a flattened buttock. So whatever they had before will probably look even worse, okay? So although the skin issue may be rectified, the other issue won't, which is the volume or the shape. And so fat transfer and or butt implants or something of that nature can always be utilized to improve that result. Now, I will tell you also that it's kind of like the tummy tuck in the front, depending upon how the fat's resected and how the skin's resected can totally, create two totally different anatomies afterwards. Like for instance, when I do the lower posterior body lift, I will take out a huge amount of fat, kind of all the way down to the fascia in the back to reduce the waist significantly. But then I will leave that fat farther back on the hip area, and then I will also leave the fat at the top of the buttock. And so when I'm contouring, creating these things, I'm essentially creating more relative projection for the buttock and the hips by the way I'm resecting the tissue and the flaps. So once again, it has to do a lot. It's not just about drawing some markings on a person and just cutting out a pattern, okay? There's a lot more to it than that, and I think that when you're considering these procedures, as a patient, you're never really going to know exactly all the technical maneuvers that are employed. So you sort of have to rely upon, the before and after pictures or videos. And so that's another reason for me to just sit here and explicate about, what I'm doing, because I think, at least it gives you some insight into, there's kind of more to it than marking, cutting out, suturing back. And granted, I'm only giving you a small percentage of kind of the things that are considered. But you should realize that everything's a compromise, and so you're compromising and trying to create the best possible structure within someone's own structure post-operatively. And then there's also the degree of healing and how well people heal. And that's not exactly predictable either. So that can be frustrating, can lead to revisions, incisions opening, things of that nature. But that is part of surgery is, you can put something back together perfectly and someone may not be able to heal it. And then you have to revise it, or there may not be a great solution for certain people. But like I said, that's the nature of surgery. Now, there's a nutritional component and sort of a patient-related component with this, and that is if you have massive weight loss patients and they have a lot of loose skin and whatnot, their tissues are ruined to a certain degree, okay? And so when you're putting them back together, you can't expect them to have the long-lasting result that someone else have. You also can't expect sutures to hold in the tissue the way that they would in someone with better tissue. And so all of this leads to less than optimal results. This can lead to, poor longevity of the results, lead to wound healing problems. All of those things you should consider. Also, nutritional parameters. If a person has, weight loss surgery, and that weight loss surgery significantly limits nutrient inflow and or absorption, then you need to, the diet needs to be appropriately checked and regulated, and as well as the vitamin intake, okay? All of that stuff can be extremely obscured and make healing very, very difficult. And so sometimes there's not a great way to overcome that, and you have to kind of deal with the inevitable healing consequences of something like that. And the patient, they are usually aware that there are significant potential problems with that due to nutritional parameters not being met, secondary to their surgery, which is usually a restrictive weight loss surgery in which, a portion of the absorptive area is reduced. And then in addition, there can be other ways to supplement it where something is bypassed one way or another, or something causes some type of osmotic kind of diarrhea where there's some malabsorption. Okay, so there are variants on all of those, and certain things are more popular in the U.S., certain things are more popular outside the U.S. For instance, lap band, popular in the U.S. for a while, and so a lot of people have a port on the abdomen, which you need to consider before you consider doing these surgeries, because you're not going to be able to improve certain aspects around the port. The port needs to remain intact, and if you manipulate the port, you may cause significant problems with the outlet that's regulating the size of wherever that port may be attached. Okay, so that restrictive component is caused by a reservoir there that you put fluid in, take fluid out, and if you do anything to obscure that, you could run into some real problems. So you never want to get into that situation. So once again, this is just a recap of some of the considerations of lower body lift, tummy tuck, posterior lower body lift, nutritional considerations for post-massive weight loss patients, those who have had weight loss surgery, those who have had pregnancies, those who have skin laxity issues intrinsically, and some of the things to watch out for and some of the things to consider before you undertake those surgeries.